So where do immune cells come from? Well, let's deal with the most important immune cell players, B and T cells. Primary organs are responsible for maturation. Where do B cells originate and mature? That's right, bone marrow. Bone marrow makes the B cells. How about P cells? Well, they originate just like all hematopoietic cells in the bone marrow, but they mature in the thymus. The thymus makes the T cells. After B and T cells grow up, they make their way to secondary organs to interact with antigens. Can you list me some of these secondary organs and structures? That's right, we have the spleen, the lymph nodes, the tonsils, and the Peyer's patches. And where are Peyer's patches most predominant? That's right, terminal ileum.
Hi everyone, let's jump right into our video on the lymph node. Before we talk about the lymph node, we should talk about lymph. What is lymph? Lymph is fluid in the lymphatic system. But how did it get there? This goes back, way back, to cardiovascular physiology and the Starling forces which determine fluid movement through the membranes of the capillaries. When the forces that push the fluid out of the capillary, which are the capillary pressure and the interstitial fluid colloid osmotic pressure, when those outweigh the forces that push fluid into the capillary, which are the interstitial fluid pressure and the plasma colloid osmotic pressure, then fluid leaks out into the interstitial space, and it gets absorbed into the lymphatic system. What is that term for excess fluid outflow into the interstitium? That's right, it's edema. So what exactly does this lymph do? It acts as a recycling system for fluid from the tissues. It gets filtered in the lymph nodes for any antigens, and if an antigen is found, then an immune response can be triggered. Now that we're at the lymph node, and the cell types involved in different areas of the lymph node are the B cells, the T cells, the macrophages, and dendritic cells. Now, as you should be familiar with, the lymph node is one of our secondary immune system organs. What are some of our other secondary lymphoid organs? Yep, you're right if you said the spleen, the tonsils, the Peyer's patches, those are secondary immune system organs too. They all allow immune cells to interact with antigen. So here's a picture again of a lymph node. If the title on this slide didn't say lymph node, would you consider any other organ? Well, I don't know about you, but it sure looks like a kidney to me. And there are some things in common with the kidney. Just as there is a renal artery and vein, the lymph node is also supplied by an artery and vein. Just as there is a renal capsule, the lymph node also has a capsule, which extends into the lymph node to form trabeculae. Also, when we talk about renal blood flow, which goes from the renal artery, eventually to the afferent arteriole, to the glomerulus, and the efferent arteriole to exit the glomerulus, well, rather than blood, the lymph travels through similar afferent and efferent lymphatics, just as you can see labeled here. As you see, there can be many afferents, but there could just be one or maybe more efferents. There's the one afferent lymphatic over on the right-hand side. So just like when we talk about the glomerulus, the A in afferent should make you think of arriving, and the E in efferent or efferent should make you think of exiting. As we talked about on the last slide, the lymph node has macrophages, part of our innate immunity, so they function for nonspecific filtration of antigens. The lymph node also stores both our B and T cells, and if it has to, it can activate the immune response. As lymph drains past the capsule of a lymph node through the afferent lymphatics, the first thing it encounters are follicles within the cortex. The B cells are localized in the follicles, and they proliferate in the outer cortex. In this image, we can see that the follicles are initially solid purple, and they're called primary follicles, which are dense and dormant. If the B cells encounter pathogens and are activated, the follicles develop a light-colored center, or germinal centers, as we see in the image, and they are known as secondary follicles. Once a B cell matures, it can serve as a plasma cell and secrete antibodies into the bloodstream to defend against pathogens. The medullary component of a lymph node consists of cords and sinuses. The medullary cords, as pointed out in the picture, consists of closely packed lymphocytes and plasma cells. The medullary sinuses, as pointed out here in the picture, communicate with the efferent lymphatics, so the exit system of the lymph node, and these contain reticular cells and macrophages. Now, between the follicles and the medulla is the paracortex. The paracortex houses the T cells. The way I like to remember it is the mnemonic BFTP. So B cells in the follicles and T cells in the paracortex, or BFTP, my boyfriend needs toilet paper. The paracortex also contains high endothelial venules, where T and B cells enter from the blood. Now that we know what's in the paracortex, can you think of a condition in which the paracortex of the lymph node may not be well developed? You're right if you're thinking of a T cell deficiency, like DeGeorge syndrome. On the other hand, can you think of a condition in which the paracortex would enlarge? You're on the right track if you're thinking of something with an increased amount of T cells, like in a viral infection. Do you remember the pathology term for an increase in the number of cells in a certain area, such as the T cells in the paracortex of the lymph node? Well, yeah, it's hyperplasia. So in viral infections, there's an increased number of T cells and paracortical hyperplasia, and this will manifest as lymphadenopathy. So let's test some concepts with a histological image. What do you think is the area that's covered with the box on the top right? You're right if you're saying that's the germinal center. of a secondary follicle. What about this next one with the arrow coming out of it? Yep, that's the mantle zone of a secondary follicle. And what about this last one? This is the space between the follicles and the medulla, and that's the paracortex. All right, that's it. Thanks for joining me. If you have any feedback or questions, please click on the thumb icon and submit your comments or queries there. Thanks. Hi everyone. This video is all about lymph drainage, so let's get started. How does lymph flow throughout our bodies? We'll answer that right now by briefly discussing what parts of the body drain to which regional lymph nodes. Lymphatic drainage of different regions is important to know because it helps you identify potential locations of infections and malignancies and metastases that feed into the nearest nodes. This image labels the lymph node clusters. In the image, colored in a dark brown, it shows that all the lymph from the right side of the body above the diaphragm is collected by the right lymphatic duct, which drains into the junction of the right subclavian and internal jugular vein. The thoracic duct drains everything left and right side below the diaphragm, and also the left thorax and upper limb into the junction of the left subclavian and internal jugular veins. Because of this, rupture of the thoracic duct can lead to a chylothorax, which means lymph in the thorax. The image also indicates which lymph nodes are palpable with a solid green filled circle, and those that are non-palpable with an outline of a green circle. Let's start with 5 of the superior lymph node clusters. The first clusters are the cervical and supraclavicular lymph nodes. These clusters drain the head and neck. What are some head and neck pathologies where you would expect cervical or supraclavicular lymphadenopathy, which you can find on physical exam? If you said an upper respiratory tract infection, infectious mononucleosis, or Kawasaki disease, then that's great. The next set of lymph nodes are the mediastinal lymph nodes. The mediastinal lymph nodes drain the trachea and esophagus, and the associated pathologies are primary lung cancer or granulomatous disease. Our next set of lymph nodes are the hilar lymph nodes. The hilar lymph nodes drain the lungs, and they are associated with granulomatous disease. Can you think of an example of a granulomatous disease? One with elevated serum ACE levels and more common in African American females, which is often asymptomatic, except for hilar and mediastinal lymphadenopathy. Well, here's a chest x-ray and CT of the chest to visualize. You're right if you're thinking of sarcoidosis. Now lastly, for above the diaphragm, let's talk about the axillary lymph nodes. The axillary lymph nodes drain the upper limb, the breast, and the skin above the umbilicus. There are a number of associated pathologies with axillary lymphadenopathy, but we'd like to highlight mastitis and metastasis, especially of breast cancer. Axillary lymph node metastasis is the most important prognostic factor in early stage disease. Now, this group of nodes often gets resected during mastectomy in order for pathology to rule out if there has already been metastatic spread from the primary tumor. So what nerve can be accidentally damaged in an axillary lymph node dissection? Yep, it's the long thoracic nerve. Do you know what muscle that innervates? Yes, it's the serratus anterior. And lastly, how would this patient present? Well, they would have a winged scapula and would be unable to abduct the arm above the horizontal position. So let's continue our discussion to below the diaphragm. The 3 main trunks of the abdominal aorta each has its own separate set of lymph nodes, and they more or less drain the areas which their arteries perfuse. Now, for a quick embryology and anatomy review, we know that the foregut derivatives are supplied by which artery? Yep, it's the celiac artery. The midgut derivatives are supplied by which artery? Yep, it's the superior mesenteric artery. And the hindgut derivatives are supplied by which artery? Yep, it's the inferior mesenteric artery. So since the arteries and the lymphatics match up, the celiac lymph nodes, they drain the liver, the stomach, the spleen, the pancreas, and the upper duodenum. The superior mesenteric lymph nodes, they drain the lower duodenum, the jejunum, the ileum, and the colon up to the splenic flexure. And the inferior mesenteric lymph nodes, they drain the colon from the splenic flexure up to the upper rectum. The associated pathologies for all of these lymph node clusters would include some gastrointestinal diseases, including mesenteric lymphadenitis, typhoid fever, ulcerative colitis, and celiac disease. In this image, I want you to recall the villus atrophy and crypt hyperplasia in celiac disease. And in this image, I want you just to have a gross visual of the ulcers and ulcerative colitis. Now, the para-aortic nodes, those drain the testes, the ovaries, the kidneys, and the uterus, which makes sense since all of these organs have their own arteries that jump off the aorta. The para-aortic lymph nodes are associated with metastasis from the structures that they drain. For the external and internal iliac and superficial inguinal lymph nodes, it's easier to remember if you imagine you're examining a patient supine, so lying down, with his or her feet in stirrups. So with just your eyes, you'll be able to see the anal canal, the skin below the umbilicus, the scrotum, and the vulva, since they're all very superficial. So those areas drain to the superficial inguinal lymph nodes. If you wanted to do a more thorough exam of the lower rectum, the bladder, the vagina, the cervix, and the prostate, those are more internal structures, and thus they drain to the internal iliac lymph nodes. The external iliac nodes are a little more confusing to think about because the nodes are called external, but the structures they drain aren't so external. But they include the cervix, the superior bladder, and the body of the uterus. As you may be able to guess, the external iliac, internal iliac, and superficial inguinal lymph nodes are all affected by sexually transmitted infections. The superficial inguinal lymph nodes can also be affected by cellulitis of the medial foot or leg. Cellulitis of the lateral foot or leg, on the other hand, is drained by the popliteal lymph nodes. So now that we've gone through all the areas, let's do a quick recap. Now, these lymph node clusters are very important and high yield for exams. So let's say a patient presents with an upper respiratory tract infection. Where would you expect the drainage to occur? So the patient is likely going to have cervical and or supraclavicular lymphadenopathy. What if a patient presented with a lower gastrointestinal pathology, such as the ileum? Now, it would be likely that there would be drainage to the superior mesenteric lymph nodes. Again, you need to remember your foregut, midgut, and hindgut derivatives. I know we're in the immunology section, but it's a great time to brush up on your embryology and anatomy. So again, these are very high yield, and please know which body parts and regions correspond to their lymph node clusters. Now, it's time to test yourself with this question. A 42-year-old man presents to his physician after discovering a marble-sized nodule on his left testicle while showering this morning. He states that he is currently healthy and his only medication is a statin. Other than his father dying at the age of 71 of a stroke, he has no other significant family history. The patient does not smoke and only consumes a couple of beers on the weekends with his friends. He denies any pain, swelling, or redness of the groin. On physical exam, patient is afebrile, BP is 126/89, and respiratory rate is 18. Cremasteric reflex is intact and the patient does not react when the scrotum is palpated. There is a 2-centimeter nodule noted on the left testicle that is firm to the touch. The organ affected by this nodule has a lymphatic system that drains into which of the following nodal regions? You're right if you said aorta. The kidneys, the ovaries, the uterus, and testes all have arteries which drain into the aorta. So remember that the testes are drained by the para-aortic lymph nodes. All right, that's it. Thanks for joining me. If you have any feedback or questions, please click on the thumb icon and submit your comments or queries there. Thanks.
Just as the lymph nodes are responsible for filtering lymphatic fluid, the spleen is in charge of filtering the bloodstream. The spleen is an organ located in the left upper quadrant. Does anyone remember at what rib level it lies? It typically lies between the left 9th and 11th rib. This is an important point to keep in mind if you ever have a patient that shows up with some sort of abdominal or posterior trunk trauma to that region. The spleen is broken down into sections of sinusoids. Just like lymph nodes,